Welcome back to chapter 11, nervous system divisions. Last video, we talked about different causes of spinal cord injuries and how the body responds to it. Now we're going to delve into the peripheral nervous system. Peripheral nervous system consists of the nerves that connect the central nervous system to the rest of the body. You have cranial nerves that come from the brain and spinal nerves that come from the spinal cord. Remember, there are 12 pairs of cranial nerves. There are 31 pairs of spinal nerves. The peripheral nervous system, or PNS, is divided into two subdivisions, the somatic nervous system and the autonomic nervous system. The somatic nervous system, remember, soma refers to a body. So, somatic nervous system, these are the cranial and spinal nerves that connect the central nervous system to the skin and the skeletal muscle. These are structures that you can consciously control. They are voluntary control. You have voluntary control of these structures. So the somatic nervous system is responsible for the innervation to the structures that you can control voluntarily. The autonomic nervous system consists of the nerves in the peripheral system that connect to the viscera. These are unconscious or subconscious activities. You don't have to consciously think about your organs functioning because the autonomic nervous system will take care of making sure that the viscera function regularly, to help keep you alive and functioning the way your body is supposed to function. Make sure that you look at this chart, this graph, the chart to tell you the different subdivisions of the of the nervous system. So you have central nervous system and peripheral nervous system. Central nervous system is made up of the brain and spinal cord. Peripheral nervous system is divided into two portions. You have your cranial nerves coming from the brain, spinal nerves coming from the spinal cord. The This is divided into two more subdivisions. You have the autonomic and somatic portions in both the cranial nerves and in the spinal nerves. So somatic and autonomic. So the structure of peripheral nerves. Nerves are basically just bundles of axons. So when we look at a nerve, when we talk about a nerve is a bundle of axons coming from nerve fibers. All right, nerve fibers. There is connective tissue that covers these structures. So remember when we were in the chapter with muscles and we saw the endomysium, the perimysium, the like all of those divisions of the coverings that cover the muscles. The same principle applies here, where you have different coverings that are going to cover different parts of the nervous system. So you have the endoneurium, the perineurium, and the epineurium. Endoneurium, inside. So this is loose connective tissue. You need to know this. Loose connective tissue that surrounds each individual axon. So an endoneurium, inside, the endoneurium is the connective tissue covering that surrounds the individual axons. Perineurium is loose connective tissue that surrounds fascicles. Fascicles are bundles of individual axons. Then you have the epineurium, that is dense connective tissue that surrounds groups of fascicles. All right, so just like the meninges, the outermost layer is a thicker, tougher material than the innermost layer. Because it is the outermost layer, it needs to be the first line of protection. So that is dense connective tissue. Nerve fiber classifications. This should just be review. So your spinal nerves, you have nerves that are classified by function and nerves classified by origin, the origin, where it originated from. So classifications by function, is it sensory, is it motor, or is it mixed? Sensory neurons receive impulses from the periphery, send it to the brain and spinal cord. Motor neurons take information from the brain and spinal cord and sends it to effectors. And then mixed neurons, mixed nerves, contain both sensory and motor information, sensory and motor fibers. Most nerves in the body will be mixed neurons. All spinal nerves are mixed neurons, except the very first pair that comes out between C1 and the skull. That one is not mixed, but every other spinal nerve is mixed. If you remember, in the cranial nerves, some were sensory, some were motor, and some were mixed, but not all of them. So there's a classification by origin. The neurons that originate in the brain are called cranial nerves. Remember, there are 12 of those. And the neurons that originate in the spinal cord are called spinal nerves. So cranial nerves and spinal nerves. And there are 31 pairs of spinal nerves. Cranial nerves, 12 pairs. They sit on the underside of the brain. They sit on the inferior portion of the brain. Most of these are mixed. Some of them are just sensory, associated with those those special senses. So you have neurons for sight, for smell, for hearing, for balance, for taste. Those are your special senses. So some neurons are strictly sensory. Some neurons are primarily motor, innervating muscles or glands to help produce some function. Most of the cranial nerves are attached to the brain stem. So when you look at the neurons underneath the brain, most of them are attached somewhere around the midbrain, pons, or the medulla oblongata. The first pair has fibers that start in the nasal cavity, which means this is probably the olfactory neuron. So first pair, cranial nerve 1, is olfactory. It's sensory for smell. The second pair, cranial nerve 2, originates in the eyes. This is the optic nerve. Optic nerve is purely sensory for sight. The first nerve, the olfactory nerve, is purely sensory for smell. Cranial nerves are numbered with Roman numerals from 1 to 12. Roman numerals from 1 to 12. So yes, you do need to know Roman numerals. You will see them again. If you have any trouble understanding Roman numerals 1 through 12, please ask, and I'll be happy to explain it to you. But you have to know Roman numerals 1 through 12. Yeah. Cranial nerves are numbered from anterior to posterior. So cranial nerve 1 will be the most anterior. Cranial nerve 12 will be the most posterior. So this is the underside of the brain. You have the cerebrum, you have the cerebellum, and then you have the brain stem. Optic nerve, I'm sorry, this is the olfactory nerve. Olfactory nerve is cranial nerve 1. This is part of the optic nerve. So it is the cut end of the optic nerve, cranial nerve 2. All the rest of the cranial nerves, you'll see them coming out on the sides or in between these structures. Those are cranial nerves 3 through 12 that are associated with the brain stem, whereas 1 and 2 are not originating around the brain stem. So these are all the different cranial nerves that are associated with functioning of the head and neck and some parts of the body. All right, spinal nerves. So the spinal nerves are all mixed nerves. Remember, they all have both sensory and motor function. They both are sending sensory information from the periphery into the spinal cord, the central nervous system for processing, and they send signals to the effectors to perform an action. There are 31 pairs of spinal nerves, 8 cranial nerves. So they're numbered C1 through C8. Remember, I said that all of the cranial nerves are associated with a vertebral column, some level of the vertebral column. There are 7 vertebrae. So the reason why you have 8 cervical nerves is because each of these nerves is coming underneath a vertebrae. So C1 has one nerve coming out from underneath it. C2 has a nerve coming from underneath it. C3 through 7 have a nerve coming underneath it. But there's also a nerve that comes above the C1. So it comes out between the skull and C1. That gives you 8 cervical nerves. The rest of the nerves are associated with however many vertebrae there are or were. So the thoracic nerves, there are 12, T1 through T12. There are 5 lumbar nerves, just like there are 5 lumbar vertebrae, L1 through L5. There are 5 sacral nerves. So there used to be 5 vertebrae that make up the sacrum. As we grew and developed, those 5 vertebrae fused to become the sacrum. That's why when you look at the sacrum, there are those holes on either side of the sacrum. Those are the intervertebral foramina, so that these 5 sacral nerves can exit the spinal cord and innervate those lower structures. Then you have one nerve associated with the one coccyx. So coccygeal nerve. Yes, you do need to know all of that. The cauda equina is formed by the descending roots of the lumbar sacral and coccygeal nerves. So these nerves, even though after L1, L2, they're not associated with the spinal cord anymore, they're still in the the vertebral column, vertebral canal, but they are individual nerves. That's why it looks like a horse's tail. And then they exit the spinal cord at their respective locations. A dermatome, derma meaning skin, a dermatome is an area of the skin innervated by a sensory nerve at a particular spinal nerve level. So when you look at images of dermatomes, you'll see these lines, basically these pathways that the nerves travel. Each nerve will travel in its own pathway, innervating structures along the way. The interesting thing about a dermatome, if you've ever heard of or seen a person that has shingles, shingles is a viral infection of a nerve. So what happens is the nerve for chicken pox gets into a body, whether you have developed chicken pox or not, the virus can get into the body and it just lays dormant. It just finds a nice nerve and it just kind of hangs out for years and years and years and decades until it decides it's time for it to get active. Once it gets active, it's sitting in that neuron, it affects that neuron. The person ends up with blisters and blisters and ulcerations, and lots of pain in that area, but it follows a dermatome. So looking here, you can see the different spinal nerves. So here you have the skull and C1. So nerve C1 comes out between the skull and C1 vertebra. The C2 nerve comes out between the C1 and C2 vertebra through the intervertebral foramina, moving on down from C1 to CO1, the coccygeal nerve. So here is an example of the dermatomes. So when the nerves exit the spinal cord through the intervertebral foramina, it then follows some pathway around the body to innervate those structures. So C2, if a person's C2 was infected by the virus that causes shingles, then the entirety of the back of their head might be affected. If they have infection in C8, it can be usually it's going to be one-sided, so both neurons are usually not affected. You'll have, say, lesions or sores anywhere along this dermatome because that's all the same nerve. So anywhere along that dermatome, if it were C8, if it were, say, for example, S1, then it would be along this root, so all the way down the leg. So depending on where that lesion is, that will determine, that'll tell you which nerve is affected because it follows those dermatomes. Let's talk about nerve plexus or nerve plexuses, plural. So a nerve plexus is a complex network of nerves formed by the anterior rami. A ramus is a branch. So the anterior branch of the spinal nerve. Let's go back to the image of the spinal nerve. So you have the spinal cord, you have the posterior root and the anterior root coming off of the spinal cord and coming together to form the spinal nerve. And remember that spinal nerve is numbered for whatever level it comes out of the spinal cord. Then that spinal nerve starts to divide. So each of these spinal nerves will divide so that it innervates different parts of the body. So once it divides, you have a posterior portion or posterior ramus and an anterior portion or anterior ramus. So nerve plexus is a complex network formed by the anterior rami of the spinal nerves. It's not in T2 through T12, so you don't have any nerve plexus in the thoracic area from T2 to T12. Instead, the anterior rami become your intercostal nerves. So everywhere else aside from here, you will have these nerves forming this complex network, these nerve plexuses, except here where the neurons form intercostal nerves. And yes, I will absolutely ask you information about this. So you must know that T2 through T12 is not part of the nerve plexus. It is instead becoming your intercostal nerves. The fibers of various spinal nerves are sorted and recombined in these nerve plexuses so that all fibers are heading to the same peripheral body part, reach it in the same nerve. So now I'll get back to that. You have 3 different nerve plexuses throughout the body. There's a cervical, a brachial, and a lumbosacral. Cervical, we already know that the word cervical means referring to the neck. Brachial, should know by now that brachial means referring to the arm, and then lumbosacral, that is that lower portion of the vertebral column. So this information about more information about the different nerve plexuses, I will not ask you those, but you need to know the 3 different nerve plexuses. So here you have The brachial plexus, this is the network of nerves associated with the arm. Brachial means arm. It is made up of C5 through T1 nerves, spinal nerves, C5 through T1 spinal nerves. So you notice how these nerves, let me blow up this image. So you notice how each of these nerves are coming out of the intervertebral foramina. Then they combine. So these nerves will combine. So this one and this one combine here. And then they separate and break off. And so when they break off, this here is a combination of this and that neuron. And then you have this that connected this nerve to that nerve. Well, this one is a combination of these two. So when it connects here to this one, where this connects this, this, and this, you end up here with, say, the radial nerve that has parts of all of these nerves or some combination of these nerves associated with these end or terminal nerves. That is how the nerve plexuses work. So again, the C5 nerve root, C6, C7, C8, T1 nerve root come together, and at some point they join together, and then they start to branch off to create these smaller nerves. Here, you can see how the nerves of the cauda equina come out and exit the spinal cord through the sacral foramina, right? The sacral foramina to innervate those lower structures. Spinal nerve injuries. So, spinal nerve injuries can be caused at birth. It can be caused from dislocated bones. It can be caused by vertebral fractures, stab wounds, gunshots, or pressure from tumors. So anything that will cause the compression, the severing, the damage to those nerves can cause spinal nerve injuries. So here are different types of spinal nerve injuries. You have whiplash. Whiplash is the sudden bending of the neck. When the neck bends suddenly, it will compress that cervical plexus, and that can lead to things like persistent headaches and pain in the neck. Because let's say you're riding in a car and the car is going 50, 60, 70 miles an hour, which means your body is traveling 50, 60, 70 miles an hour. So if there's a sudden stop, then your body, the car stops, but your body, your brain, your parts of your body are still moving at that speed until it is stopped by some force. Your body will then be stopped by your seatbelt. Your head might be stopped by the airbags. The airbags, so your head is stopped by the airbag. Your brain is stopped by your skull. Your skull might have been stopped by the airbag, but all of this is stopped suddenly. So when the car first stops and your head is still moving, but your body has stopped because of the function of the seatbelt, then that quick, sudden flexion of the neck can compress those cervical nerves and cause problems. That's whiplash. Broken or dislocated vertebra in the neck. So anytime you have a broken vertebra or a dislocated vertebra, it can compress or cut the axons of a neuron, and that can result in paralysis of some area of the body, namely in this particular case, the diaphragm. So if the diaphragm becomes paralyzed, remember that the diaphragm is responsible for helping you breathe. So if your diaphragm becomes paralyzed, you can no longer breathe on your own. You will pass away. if you don't have mechanical intervention or machine breathing for you. There's thoracic outlet syndrome. This is pressure on the brachial plexus due to continuous flexion of the arm. So if a person continuously types, continuously paints, continuously hammers, those repetitive motions can lead to inflammation of the tissue. That inflammation of the tissue can lead to pressure or compression on the brachial plexus, and that can lead to pain or discomfort anywhere from the neck to the fingers, depending on which nerve root is being affected by that continuous flexion of the arm. You have sciatica. Sciatica is compression of the intervertebral disc in the lumbar region. This this nerve in particular is one that travels, it leaves out of the lumbar region and then it innervates the lower back, the gluteal region, the calf, the thigh, the foot. And if it becomes compressed, a person can have pain down the entirety of the leg or can have pain in some particular aspect of this area that's innervated by the sciatic nerve. Then you have carpal tunnel syndrome. Carpal tunnel syndrome is also caused by repetitive movement. This is the hand. In this case, the hand will have inflamed tendons. There is a tendon that covers over the carpal bones anteriorly. And with repetitive motions, that tendon or that membrane can become inflamed and swell. And when that happens, it can compress the nerve, which is the median nerve that goes between the bones of the arm, of the wrist, and that membrane. So by going between the two, when that membrane is inflamed, it compresses on that nerve, and that results in pain and decreased function of that nerve. Pain and decreased function of the parts of the arm and the wrist that nerve services. So know these different types of spinal cord injuries. Let's end let's end with that, and we'll finish up this chapter in the next video.